Good afternoon, everyone. I am Dr. Erin, and I own and operate Van Family Chiropractic, which is in Dallas, Texas. It's off of Preston and 635, so it's just down the street here. And I'm going to talk to you today about chiropractic neurology. In my office, I have 4 specialties, and the first is chiropractic neurology, which I'm going to speak extensively about today. And then I also focus on soft tissue rehab and cranial adjusting. And cranial adjusting is important. You've seen a lot of cranial adjusting specialties in the expo perhaps, and this is very different than most cranial adjusting. It's neurologically implicated. So if any one of these plates of the skull gets imbalanced or starts to push against another, it can actually put pressure on the brain and decrease the nutrients anywhere behind that or in front of that area. So I do a lot of cranial adjusting. Any one of these bones can become immobile and put pressure on the brain. So I fix that in my office. And the last thing I specialize is in pediatric and prenatal chiropractic. So chiropractic for the baby and the mother. Let me ask you a question. What is the master control system of the body? Does anybody know? So what system controls all other body functions? Central nervous system, which is kind of a giveaway since I'm talking about the brain. But the way you know that, if maybe that wasn't your first intuition, some people say the heart. The heart is a very good answer, except for we know that we can take the heart out of the body and we can replace it with an artificial heart called a pacemaker that will help, or we can actually replace parts of the heart with artificial parts or even human parts. We also know that the lungs, we can live without one side of our lung. We can replace part of the intestine. We can totally remove the gallbladder. So most of the organs in our body can be taken out and replaced with either an artificial organ or system, or it can be replaced or totally taken out. So the nervous system's key because we know that we can't take out a part of our brain or our spinal cord and live. We know that that's extremely important. And that's why we have helmets. We have safety belts so that we don't hit our heads on the steering wheel. We have airbags. So we take a lot of precautions to protect our head and brain. And what I want you to do is think about it just a step further. And that is, if you're going to protect your head and brain, let's also make sure that it's functioning as best it can and that it's healthy. The brain, of course, since it controls everything, we have a cycle in our body. And this cycle is hopefully present in everyone. And what I evaluate is where those problems happen. And you'll see on your handout, that very first page, you'll see that the cover page there's a cycle. And it starts off with the brain here. And then down here, you'll see the spinal cord. So a lot of people have been to what I call traditional chiropractors. And traditional chiropractors will adjust the spine. And they don't really look at the brain too much. And you get really good results with traditional chiropractic because what happens is the spine actually gives the brain information. So the way I like to tell my patients and explain it to people who maybe haven't thought about this before is that the spine is essentially like rabbit ear antenna. So you guys remember rabbit ear antennas? I see some pretty young people, but maybe you've seen them on eBay or something. Rabbit ear antennas go on the TV, right? And then it's supposed to give the TV the best reception possible so you can get a good picture. And we know that as we're playing with our little brother or something, he inevitably hits the rabbit ear antennas and it falls off to one side. And what kind of picture, what happens to the TV when that happens? It's blurry, fuzzy. You don't really get to see anything. It's just fuzzy. And that's what happens in our body also. When the spine gets off-centered, it's our rabbit ear antennas, and it creates a fuzzy picture in the brain, and we can't enjoy the entertainment that we were supposed to once have.